Well, to begin with, we are very thankful to the company Implant Swiss, the producers of one of the short implants available in India, for having given us the opportunity and with their support to arrange this small demonstration program. With me is Prashant. Mr. Prashant, he is heading Implant Swiss South India, and Feroz, he is heading Implant Swiss Karnataka, and newly appointed Mr. Shinde.
Yes.
Somewhere there. So he is about to take care about the Gulbarga region, including Bangalore and Raichur and other places. Anyways, so let us start with basically trying to understand what the kit exactly contains. Now, usually this sharp tip thing, in other companies they call it as pilot drill. Here we have named it as point drill. That's the same, the name is changed. And it really means a point because usually this we try to just demarcate or initiate the drill. Okay, we don't really go through into deep osteotomic preparations in this. Okay, following this, the next drill we have a 2.8 drill. Okay, now in 2.8 we have different sizes. We have 4 mm, 5 mm and 6 mm drills. Okay, now this set is mandatory. Now from here there is a bifurcation. Okay, onto the top 3.7. Okay, and to the bottom it is the pilot drill. Now what this demarcation means, when you have a D1 type of bone or D1 or near to D2 type of bone, we need to go with sequential proper drilling. So that is the reason there is also a direction indicator here. After 3.7, according to the length what you have chosen here, you can go with the progressive or sequential drilling. Okay, so whatever is the chosen diameter of the implant may be exactly the same, or depending on the type of the bone. If you feel that it is not exactly D2 and it is more softer, then you try to under prepare the osteotomy and do the crestal preparation using this slot. Okay, that is what I will be explaining. Now, so for D1 type of bone, we use this upper chamber instruments. Okay. Now, from here we get deviated towards the pilot drill and then the final drill. And if you see this is for D2, D3, D4 type of bone. The length of this drill is hardly 2.5 millimeters. Whereas our implant we will be going with will be either 4, 5 or 6 millimeters. Okay. So basically what this drill is doing exactly is it's only removing the cortical bone at the osteotomy site, and it is not going to touch the trabecular bone either. Okay, so with the placement of the implant, what happens is there is condensation of the trabecular bone or softer bones. So this usage of this maybe 4.3, 4.8 or 5.5 mm drills will only ease the placement of the implant so that it is easily accommodated there, and we don't have much of resistance from the cortical plate at the crest of the ridge. Okay. Now, what happens if there is lots of resistance at the cortical plate? There are microfractures, and in long term they tend to resolve. Rather, if you remove a chunk of the cortical plate and just go with the implant with a few newtons of torque around it, then there is a major chance that there is minimum resorption of the rest. Okay, so we don't wish to have micro cracks even in the cortical plate. Okay, now this you have wrench. Now this can be used in two directions. Okay. One hand with the mic, I'm able to explain you that. We'll do it away. Anyways, now this kit is again having a parallel. So when it comes to drivers, these are the fixture drivers. One is a long and one is short. This is engine driven fixture driver. Okay, similarly the same with the red. Okay, the white section, the red section. And these are the wrench driven, again fixture drivers. Then you have common heads. Okay, one is long and one is short. Okay, this is again 1.2 heads. Now the difference between this white ring equipment and the red is that red denotes tissue level implant and white denotes bone level. Similarly, the implant packing also comes in the same way. A red box means tissue level implant and a white box means bone level. Now there is also a difference in the design of the bone level as well as tissue level implants. The bone level implants have aggressive threads, okay, whereas the tissue level implants are less aggressive. And the tissue level implants are recommended in only D1 type of bone, whereas the bone level implants are recommended for D2, D3, D4 type of bone. Okay? Can anyone guess why is that? Okay, with similar design, can we do it? See, usually what happens is, the primary stability we expect as an outcome of our implant placement for D1 type of bone is good, maybe 40 plus. And in such a case, if the collar of the implant is just getting almost out of the gingiva, that means the tongue is going to be in contact. There is an interference. If the primary stability is less and the tongue keeps on hitting it, then this generation of microactivity, and that causes failure of the implant. Okay, that is why whenever you have a poor stability, compulsorily it needs to be embedded or closed kind of thing. Okay, no heating screw, no tissue level implant in cases where you don't achieve a good primary stability. Very important. Okay. And on the other side, yesterday we were talking about, we never recommend a one stage or immediate loading protocol in short implants. Never. Okay. So this is about the kit, right? And this is about the implant. Now talking about the surgical protocols, the recommended RPM to be used for implants is maybe 200 to 350 RPM only. We have seen other companies saying go up to 800, 1000, 1200, 1400 depending on the type of bone. But the drills are so designed that they are not meant for high speed drilling, they are meant for slow drilling. Okay, so for D1 you can go up to 350 and for D4 up to 200. It's less. So this will avoid heat being generated at the osteotomy site. Okay. Now this is purely because of the design of the drilling bits. Okay. Now, open this. Someone has to hold this. See, the implants come in dual packing. One is a plastic coating which needs to be cut. Okay. And then the box again has to be opened. So it is good to open such a box, right? ज्वेलरी बॉक्स जैसा है ना, इसलिए बोल दो ज़्यादा लड़कियाँ नहीं। Okay, so what we have here is 4.3 into 5 short implant in a white box. That means it's a bone level implant. Okay, now this is how it comes. The implant space always comes in a glass bottle. There is a special protocol followed to keep the best sterilization standards. Okay. Now the second one. This is again a jewelry box with a jewelry here, right? This is again 4.3 into 5 tissue level. Okay. Now you have a opening side here. We'll open it and then we'll these are double. आइसक्रीम समझ के दूसरा she knows that I like the black वो भी काला anyways see when you open the box okay this comes in a glass bottle okay and this blue portion is a PEEK material okay and it is covered with a metal covering so you remove this you can see the implant okay yes and the creamish gray colored thing that's again the PEEK okay once the implant is removed place it in the bone okay this white portion is removed out and you can see that there is a cover screw given not healing screw cover screw okay so this is how it is going to be and so we are going to place 4.3 into 5 so accordingly we need to do the required and we have a specially designed specially super atrophied mandible for us okay even I am scared to drill in this because I might just peep out of this lingual fossa here okay so we have got a real tough model for us here. Thank you, Prashant. So, we are going to reduce the speed. We are going to reduce the speed to 350. Okay. And we don't need water here. We understand, I am not here to make you understand is a dispenser. Okay. And the door here. I'm more used to using a Dublin dispenser. I use this in Nestle only in my department and I really don't know how it is. But we use it, so it's not familiar to me. It's all on order, you know. Change kar le, ho jata hai. It's all over. Anyways, where do you want me to drill? You can see the beautiful model. You can see two bundle foramen. Definitely posterior. Anterior you have a scope of a longer implant. Okay. So we'll go in 6. Okay. Be very careful about this lingual concave. Okay. So one finger rest here. Very important. Right? And can anyone just give me a point where to drill? Mark it. So we have to go drill here. Okay. Can you see where the point of my choice is slightly buccal in this case? Because I am really scared of this. Okay. So you are going to place it straight. Tilting of short implants is not allowed. Okay, fine. So, what drill is this? Point drill. Point drill. So, you go here. 1 mm. Okay. Then go to the next. Okay, how many of you would like to try this? So we are going to go with how many implant? 5 mm. So I always have a tendency to prepare 6 in my practice whenever I want to go with 5, because I like to submerge. Anyways, right now I'm going with 5. Okay. So again, you can see the speed is 350. Okay. And these birds are uniquely designed to collect more nutrient. That is another reason why the speed has to be less. Okay. So when you see this, okay, this collects. Even when you drill it in the mouth, it collects. Okay. So can you see this is getting drifted? I cannot hold the patient's jaw like this, definitely. Nor the patient's jaw is moving so tough. So this is 5 mm of preparation. Okay. As I told you, I always have a tendency to prepare more in length, because the dust in this, if it is not out, still my implant will go to the final position. So, I am trying to add a lingual pressure so that I don't come onto the buccal aspect. Because of this fossa, we have tried to be slightly buccal here. So at the same time, I don't want to destroy the buccal plate completely. This is 6 mm. Yes. So from here we need to choose what is our next. We are open a tissue level. So we will go with 3.7 here. Okay. The same direction. So this sequential drilling is what is in what? This is a 5 mm drill now. Okay. And if at all I am feeling that I am going to more buckle, what will I do? Link forward. Still is 15. So what will you do? We always have this pilot. Okay, this will help us to move a bit leaner. This is what you have to learn in manipulation. See this? You are now more legal. So what is the size of the implant you are choosing? 4.3 into 5. which you would like to do the implant placement. Implant placement, speed, top, control. You are familiar with any protocols? No? Whenever you are going with the final positioning of the fixture, okay, it has to be with a minimum torque of 20, okay, and when you are picking this, you always take it across, then move like this, okay. It gets locked, it does not fall off very easily, and this your instrument is wrong, okay. So with this, so now you have 10 speed and 10 torque. Okay, we can start with this as of if you want, but I prefer using 20 and 20. Okay, so with this in position. So, can you see this? Because we don't have a soft tissue covering on this, you can see this is totally exposed. But imagine you have a 1.5 to 2 millimeter thickness of tissue in there, then you are going to get a closure exactly at the collar. Tissue will be closed exactly. See, because we have prepared it exactly around 5 mm. Why am I saying 5 after preparing 6? Because I believe there is 1 mm of address given here. Okay? And the 6 mm I prepared was only for this 2.8 mm. The remaining I stopped at 5. Okay? Now, the next, you want to go see this is your bone level, and as we said, this is more aggressive because it goes into the soft bone. So it has to just accommodate the soft bone there. Okay. So this is a hand instrument, just to show you the implant. Done? So, so, one more here. Who wants to do? Huh? Once. Once. Huh? Okay. You have to be careful. आ जाओ, बैठो. खड़े रह के करेगा, बैठ के करेगा. बैठ के करना है. You are conservative, not in oral surgery to stand. Don't you stand and work. The pointer should not go beyond 1.5 to 2 millimeters. Now, we can start with the 2.8 one. What is, see that is 4 mm in length. Your understanding with the hip is very important. When you slide, you can use 6. This is the size. After you, many more would like to do this, so you need to be fast. Anyone else in queue to try this? One intern. You can always do this. In very rare instances, we have exactly the same amount of bone in length. So you can see how the bone is getting shaved and corrected. So this is of course here we are working without water, without irrigation. Okay, but even with irrigation, okay, the burr will definitely collect water. Quality of bone is weak. So, if the quality of bone is D3 or D4, this is the part. This is D1. Even for this bone level implant, we will do yes. In between, see in this case, you need to keep evacuating this debris. 5 minutes. Don't stop in between. The drilling has to, you have to just go in and move out. Why are you going so slow? You are not touching 350. That's it, that's it. That should be the final result because your implant you have chosen is 4.0. Here is the implant. And instrument also you can place it and talk again. Second one. Now, you can talk it in. We never call it tightening, we always call it torquing. It stopped, you can take the wrench. Okay, now you have a direction here. Can you see this? In and out. Okay. When you do this, your finger has to be at the top here. The force has to be in line angle with the implant, longitudinal axis of the implant. See, here, okay. Breaks. No. Your load has to be there. You're going with lateral force, so it's going to destroy the bone around. They will ask a big party from Rahul Sharma. Sponge wale andar. Chocolate, mango bite. See, you are using this, but there are some markings here. Okay, so that is the torque control. Now, the position your torque indicating gauge is at shows you how much of the torque you have achieved in placing the implant. Okay, so here is it's going less than 20. Okay, so this is how a bone level implant is placed, and of course after this you will close it and then you have something tissue level. This is for the tissue level thing. Okay, so take a hex driver. So this engages the head here, and this is for the cover screw for the tissue level.
तुम्हारे ऊपर तालीस में
And can you see the healing screw here? I mean the cover screw here. This is for the bone level. Okay. So this is how it gets closed. So whenever you are placing the fixture in final position, the torque should not be more than 60. Okay, preferably it should be above 40 and less than 60. Okay, that is the best bone to implant contact you can desired for. Okay. Anyone else? आ जाओ जल्दी आ जाओ. What happened? See, basically the distance between two implants always has to be minimum of 3 millimeters. Okay, minimum of 3 millimeters. Remember this. Because when it comes to molars, we tend to give a slightly increased distance if the diameter of the implant we are using is less. Okay, when you are using 5